together, we can definitely do our best to, to push it forward for other people to also be in the same space that we're in, or even do better than what we are doing. So yeah, it is an honor and a pleasure to be able to participate in this journey. Yeah.
Awesome.
Thank you. Do you want me to start, Luteho?
Yes, you may start. Thank you.
Okay, so my task is to just speak about the anesthesia diploma that we are about to start in October. So you might be wondering, why should you prepare for it? Why such a big deal? How is it going to help you in your, is it doable? There's often a fear when we are about to start something big, but there is this quote that I really love. Okay, my slides are not moving.
Just click anywhere with your mouse on the slide. It should start to move.
Okay.
Still not moving?
Not moving. Oh, okay, there we go.
Okay, you're good? Okay, we'll see how it goes. Otherwise, I'll share from my side. Thanks. Yeah.
Yeah, I prepare things and things happen. But anyway, so there's a quote that I love by Marianne Williamson, which says, our deepest fear is not that we are inadequate. So it's not that we can't do it, but we are scared of, we're not scared about the fact that we're inadequate, but we're more scared about our light, not our darkness that most frightens us. We ask ourselves, who am I to be brilliant, to be gorgeous, to be talented, to be fabulous? Actually, ask yourself this, who are you not to be? You are a child of God, you're playing small. Your playing small does not serve the world. There's nothing enlightening about shrinking so that other people won't feel insecure around you. We're all meant to shine as children of God. We were born to manifest the glory of God that is within us. It's not just some of us, it's in everyone. And as we let our light shine, we unconsciously give other people permission to do the same. As we are liberated from our own fear, our presence automatically liberates others. So I love this because every time I'm about to embark on something that totally scares me like this one, I always remember this. And it gives me encouragement. And I want to give you the same encouragement as you are trying to write this diploma. It is not going to be easy. It's not meant to be easy. So why should you consider doing the diploma? You're doing it to improve your skills and your knowledge, improve your confidence and your competence. Job opportunities in public, now in our country, there's quite a uncertainty when it comes to jobs, especially for medical officers. So if you acquire this diploma, you're able to be in competition with everyone else and hopefully be the one who gets employment. But also, there's also a part that we never talk about, the private sector. I have a friend who did his diploma and he's completely in private and he's doing well. We are very scared about leaving the public sector because of maybe security. But I think if you plan it well, you can have a lucrative business because it becomes a business. There's also plans of going to specialize, which the diploma will open that first door for you to, hopefully when you go for interviews, to be considered as a candidate. There's also the GP who just wants to learn about anesthesia. And funny enough, the drugs that we use in anesthesia, even in casualty, we use them all the time. But having a better understanding of those drugs and how to use them and how they affect your patient is very important. There's also moving abroad. Some people want to move abroad, but in order to move abroad, you need to have certain skills. And as far as I remember, anesthesia is one of those skills that very lucrative in other Western countries or abroad. We eventually, as doctors, want to better manage our patients and care for them. How will having the diploma benefit me professionally? Remember that anesthesia uses drugs called anesthetic drugs, which we use to take away the pain during a medical procedure. We use local anesthetics and regional to numb a certain part of the body. We use general anesthesia, which temporarily takes away the patient's consciousness, which allows the surgeons to perform their surgeries. We all have in some way on another level, we do give our patients anesthesia. May not be in the theater setting, but we do give anesthesia to our patients. We should all aim as doctors to provide safe care to our patients and improve our knowledge and skills in a better way to better give them care to those who trust us with their health. So what are the College of Medicine of South Africa requirements in order for you to eventually sit and write the exams? So you need to be in a supervised training center or a CMSA approved hospital for at least 6 months. Or you should have, sorry, I just need to move this. Sorry, Lisa, I just need to move this because I can't see my slide. Okay. You should be 3 months supervised training at a teaching or CMA approved hospital with 500 points completed in your logbook. I've never done the logbook thing, but I think if you're not in a hospital where it's CMA approved and you need to visit, they want you to have a completed logbook. But I know my colleagues have done logbooks, so I think it will hold you in a good state if you have a logbook and you can prove that you've done a certain number of patients. Then you will be able to qualify to write the DA. When I check the website, the Diploma of Anesthesia now, the cost of it is about 15,800. That's a lot of money to put somewhere and not be able to, and not pass an exam. So how is the exam structured? So at the moment, after COVID, they changed the exam. So you have 3 papers that you write, all 3 hours. You have short answer questions, 2 of them, and then you have 120 single best answers questions that you write. I have to say that because I did write the exam during this time, it's quite intense. The 3 days that you're there, it's quite intense because 3 hours just sitting in front of your computer, because it's all computerized. It's quite intense, and you're typing and you are meant to focus and concentrate for that long, but it's doable. So the CMSA on top of you being in a hospital that is CMSA approved, they require you to have a letter from a supervisor, and they also require you, after you have applied, there's an assessment of competency that you have to go through to eventually get to writing. So let me just try and explain. So you will apply on the website, you will pay the 15,800, and you will have sent with that your letter from your supervisor. When the closing date comes, after the closing date, then they will send the candidates an assessment of competency date that, depending on which area you choose to go to. If you choose to go to Joburg or Pretoria, they will assign you to a hospital, and that's where you will go. So you will be offered 2 opportunities to perform the competency evaluation per examination cycle. If you are not competent at initial evaluation, you must return and you can be re-evaluated again. If you are not competent for the second time, your application to write will be declined and you will need to reapply again. But as far as I was told, you get a certain percentage of the money that you have paid back. They keep a certain percentage, you keep a certain percentage. And then in the website, you also find the curriculum for the DA. I'm just going to try at the end to go through the website so that we can go through the competency and the letter of supervisor, the letter that your supervisor has to fill in. So we were asked to also just talk about our experience in writing the diploma. I'm going to talk about mine. Dr. Mahlalela will add hers. But what I learned worked best was that you need to plan your study time daily. We do have a very busy working schedule. You have your family, you have your work, and you do have course that you have to work around as you decide to study. So what I used to do is that I would, because I have a family, I would work, and then after work, I would assign a 1 hour somewhere in the hospital. I did find a room where I would sit down and I would work on a topic. And it does something to your confidence as well. You don't feel like you're just saying you're writing, but you're not doing anything. So I used to do that, and it helped me a lot. It helped boost my confidence, because the hardest part of deciding to sit for an exam is starting to study. Once you start and you have a momentum, you are able to feel like, okay, I think I can do this. So that's the beginning. And then after you've done that, you plan to use the textbook when you have time to make notes. The prescribed textbook is Morgan and McHale. And I will be honest with you, it's not the easiest book to read. So what I would do is that on weekends, when I'm free and I have time to sit and study and concentrate and I'm fresh, that's when I would tackle the book. But otherwise, after work, I would read already prepared notes that you find from different sources. And the other thing that helped as well was that you start with a topic that is more difficult for you, a topic that is new for you, and one that you know that will take time for you to get through, so that you can finish with the ones that you obviously are comfortable with. The other thing is you try also during your working hours, if you do work in anesthesia, revise what you are studying with your colleagues, go through certain topics with them, ask them to quiz you or discuss topics that might not be clear. If you have questions, I used to ask our neurosurgeon. If I'm studying part on neurosurgery, I would ask him to explain certain concepts to me, and it helped a lot. And the other thing is practice textbook anesthesia when you're in theater. So it makes it easy if you are in the exam and you have a blackout or something, your mind just goes blank. You know your point of reference is what you do every day in theater. It makes it easy for you to know, okay, what would I do if I was in theater? If they ask you about, I'll give a hypothetical example, thyroidectomy, anesthesia for thyroidectomy, how would I go about it? If you have a case that you're doing and they're doing thyroidectomy, you do it according to how the book asks you to do it. And that way it will be easy for you when you get to the exam. Another thing that I used was I used podcasts, I used YouTube videos, I used short notes to cover something daily. And also set enough time to go through past question papers, something that I didn't do enough of. But in the end, I realized when I eventually started doing them that I should have set enough time to go through past question papers, because they do help you quiz yourself and see how much you still need to cover or how much you need to learn. Dr. Mahlalela, do you have anything to add to how your experience in preparing for the diploma?
Thank you, Dr. Hlawole. I think, yeah, everything that you mentioned is very important, and it definitely does help a lot. But also, just to add on that, case presentations, because what you mostly would find with the questions that they ask you, it's not a direct question. You'll find very few questions that are very direct, but most of the time you'll find case presentations that will then you'll be asked a question based on that. And so doing presentations during your rotation in anesthesia, case presentations of patients that you've seen, or just like normal presentations that you'll have within the department, that definitely does help because it also keeps your knowledge up to date. Yeah, and I found that with the previous people that we've had in our department, they would always come to us and ask if we can just sit in a presentation, and they will go through it, and questions will come up and we'll go through the questions with them. And yeah, we definitely had a very good, I think, I don't remember anyone, maybe Dr. Hlaule, maybe one or two people, but most of our candidates that were in the department actually did well. So everything that Dr. Hlaule has spoken about really does help a lot. So I think if you stick to that and manage your time very well, yeah, and ask questions. Anytime you see someone that knows something, ask questions and revise.
Yeah, thank you. Thank you, Nelly. The other thing I wanted to add is don't think any question you have is a stupid question. And don't feel that you are supposed to be on a certain level of knowledge or skill or whatever. Like Dr. Mahlalela said, we work together and I still ask her things. And we have to get to that point as doctors to be comfortable, that we don't know everything. So ask questions and ask your colleagues if you have difficult cases you want to discuss with them, you want to know how they do it differently, ask them. That's how you're going to grow. That's how you're going to learn. That's how you're going to be a better doctor, and you're going to give anesthesia in a much better way because someone else might understand a concept way differently than you do. So it's important that you are in an environment where you allow learning and you do not allow pride and all those feelings that sometimes keep us from becoming what we should be or learning. You become open to learning, so that helps a lot. And I just wanted to go through the recommended books by the CMSA. They recommend Morgan and Mikhail, and I don't know the Saving Mothers section monogram, but it's there on the website, and the website is there as well. And they also recommend the ESMO. But I kind of felt like it wasn't enough because I know that I didn't just use the Morgan and Mikhail. So I would suggest that you use some of the books that you get from different universities. Like Peter Marisberg has a wonderful book. UCT also has a beautiful manual that they use for students and interns. And Peter Marisberg also has compiled a beautiful book, which I think I have sent to Dr. Mawela on DA notes. They have compiled a different case studies for different topics. And that's what will help you as well. And also finding out if there are refresher courses that are out there. I know when I was about to write, there was one from Wits, because there's different universities that teach, they take turns to basically set out questions for the DA. So usually the one that is giving the webinar, the refresher might be the one that actually is setting out the questions. And they do explain, and it goes on for almost the whole day, and they answer questions, they give you case studies. It's quite interactive. You can go there live or you can do it on Zoom as well. And another source that I found, it's like I said, the podcasts. There's one on Spotify, Anesthesia on Air, and there is ABC of Anesthesia. ABC of Anesthesia also has YouTube videos, which are very helpful because part of our anesthesia is also sometimes doing the OSCEs. So that is also a wonderful source to look at. And I found that with the podcasts, and if I was not in the mood to sit down and read a book, at least something would be going, there'll be an audio and I would be somehow getting some kind of knowledge from listening to something. So that helped a lot. So how do we plan on helping you? So how do we plan on helping you prepare? So the program is designed to start in October this year, and it might run through the end of January or beginning of February, depending on when the exam is, but it's usually in February. All in all, it's supposed to run for 12 weeks. We are going to have it twice a week, Monday and Thursday at 8 o'clock. We're going to confirm the Monday and Thursday, but so far that's what we are thinking of working around. We will cover the most important topics. The decision to write the diploma requires commitment to acquiring knowledge and understanding. And this is what we hope to bring to you with this program. And all we require from you is commitment, because it is going to become difficult. It is going to become overwhelming. But just be committed and don't give up, because you will see in the end, it becomes overwhelming, especially with the amount of knowledge that you have to acquire. But believe you me, when you sit there in the exam, you do remember. The brain is an amazing organ. With our skill and experience in anesthesia, we hope to fill in those gaps that you might have and help you eventually acquire your diploma in anesthesia. So I found this upcoming refresher, but I don't think it's on Zoom. I think you have to be based in Cape Town, but it's going to be run on the 17th of January, and it's going to happen from 8:30 to 2 o'clock. And there's only 30 spaces limited, and it looks like it's a one that I don't know why they did it in January. I don't know if it's gonna help you guys. It might help you just because what they're presenting is what you need for your assessment of competency. They need you to have to know how to do adult CPR, pediatric CPR, machine check, and airway. So maybe they are doing it in preparation for those who will be writing in June or July. I'm not sure. But in the exam, they can still ask you about adult CPR, pediatric CPR, and machine check and airway station. So I found this online, and if you are around Cape Town and you feel like you can go, please attend. It's there. And someone is putting in the work so that they can help you pass the DA. So we do have a timetable that's supposed to follow. We are finalizing it because we have to share we have to share the topics. But thank you for listening, and your references are there. Are there any questions? While you ask questions, I will go to the CMSA website and try and help you see what I wanted to see earlier. Are there any questions while I try to go?
Yeah. No, thank you. Thank you so much, Dr. Mpo. I think that was quite comprehensive, but importantly, motivating and encouraging. Maybe before you close off, as you try to get to another page, just to check, Dr. Nelly, anything you want to add from your side, one or two things, and then we go through a couple of discussion points, and then we take it from there. Yeah. Mpo, I think in the meantime, you can stop sharing and then find the website and then reshare again. Thanks.
Okay.
Yeah. Yes. Hi, Nelly. Sure.
Hi. Yeah, well, from my side, I think I would just like to encourage anyone that wants to participate in the program, that even if it's not about you obtaining the diploma, but I think if you think about anesthesia in totality, it requires expertise in different fields, and it looks at a patient holistically. And what we do is we need to know the physiology, we need to know the anatomy, we need to know pharmacology, we need to be able to monitor patients. And those are things that you can actually use in any field of medicine. So if you approach it in that manner, whatever the reason is for you to be in this program, you will definitely gain something out of it. And yeah, and just be a better skilled.
Awesome, awesome. Thank you for that note. Yeah, maybe some. Okay, there were a number of questions, but I always have my bag full of questions. By the way, so Balate says I'm covered from my side, so I think the information was quite clear. Lebu is asking, is this course for doctors only? All right. So, yeah, for the other disciplines, I could easily answer this, but anesthesia, it's probably for doctors only. I know there's clinical associates who are being trained to provide anesthesia. You would probably join to improve your knowledge and competency as a clinical associate. You will get a certificate from Clinical Care Platform that you did attend this program and completed it. But the College of Medicine of South Africa, the actual exam, it's mainly for medical officers. Dr. Mpo or Neil, I know you guys, you do a lot of mentoring, whether it's interns, there's probably clinical associates as well. Can clinical associates benefit from this program? What's your thinking around this question?
Yeah, they can definitely benefit from this program because, like in our hospital, in our center, we've had a few clinical associates that are allocated in anesthesia as per their program, and they spend about 2 weeks there. I think Dr. Hlaule can elaborate more on that because she actually is the one that looks after them when they come to the department, and they do have requirements that they have to meet when they rotate in anesthesia, which part of it is how to monitor patients. They need to know about mission safety. They need to know about, they also need to know CPR, like some of the things that Dr. Hlaule has already spoken about. So there's definitely a benefit in them joining the program.
Yeah, and they will join like me because I just need to up my anesthesia confidence, and then the exam I'll decide towards the end. Dr. Po, you want to make a comment on this, and then
Yes.
yeah.
So yes, they do benefit quite a lot, and I think if you join this coaching program, they don't spend enough time with us in anesthesia to be able to appreciate some of their drugs, their understanding of how they work, and the physiology and some of the pathophysiologies that maybe change the way you might give a patient anesthesia and you might eventually ventilate, and how they do have a limited time with us. Most of them, by the time they leave, they wish they could stay longer, but their program, I think they're with us for about 3 weeks. And even in that 3 weeks, one day is for them to meet with the family medicine consultant where they have presentation, and then I think there's another day they go somewhere, but they don't spend enough time with us. So having going through this program will really help them to just consolidate everything and just up their knowledge and improve their skills even more.
Awesome.
Yeah.
Anonymous is asking about, this is probably an anonymous who's already registered, I suspect. So remember, the program starts in October. Dr. Mpo has set a slide with some of the textbooks that maybe you need to get and start reading. But with us, everything will start in October. We do live coaching and we share materials as we go through the live coaching. It is not an e-learning course, but we go through various sessions. I will take information I think shared by Dr. Mpo and share with those of you who are already registered for the program. So yes, we do have colleagues who have already registered, and we are so excited for you trusting us with your professional development, but also the opportunity to add value to your lives, and to improve, the overall competency in the field of anesthesia. So the competency preparation, this is very, very practical, and obviously the college wants to verify, what you would have put in your letter to say you would love to write. They want to verify that you are good with the basic CPR and etc. We are likely to have maybe one session closer to that, just to give you some tips, but it's as good as how much time you have spent in that space. I don't know, Dr. Mpo, competency assessment and preparation, your comments there?
Sorry, I'm actually trying to get to the CMSA
To the side.
website
Yeah.
so that I can share.
Okay.
Yeah, but now it has kicked me out. But
Yeah.
because when you click on the competency, they go through, they actually, it's so, well, they're giving it to you because they actually tell you what you need to read, and they give you the questions. They basically give you a, what did we call it, a mock, I don't know, they give
Scope.
you a scope.
Yeah.
But it's not even a scope. They literally telling you, ask to inflate the cuff, ask to do this, and you need to just know how to do those things. But I think the reason why they went about this is because they found out that even though people sat for the exam, they didn't know how to do the basic resuscitation of patients. And they did take away a bit of the OSCE from when they during the COVID time. So I think they're trying to bring it back, but they are bringing back these 4 only to check if everyone is competent.
Okay.
Initially, it used to be a bit more intense. You would sit down and have a viva and they'll ask you questions, but they don't do that anymore. So this is a little bit different.
Yeah, Dr. Lewis wants to know the sessions, and I know why. I know some colleagues are also joining more than one diploma preparatory program, because one needs to appreciate if there's any clashes. Yeah, so I know initially there was a Friday there, Louis, but it's likely to be Mondays and Thursdays. Am I correct, Dr. Nelly? The most likely is Mondays and Thursdays.
Yes, Doc, you are correct.
Yeah.
The most likely will be Monday. Initially, we did think about Friday, but now we are considering Monday and Thursday.
Thursdays, yeah. And just to say that for every single session, if you miss to attend it live, number one, you'll get access to the recording as a self-paced version of that session. But also there will be a community that we host virtually, where if there are questions, even after watching a self-paced version, you can actually post them there, and we will try to respond to your questions. Mondays and Thursdays, Louise, are the most likely. I know Mondays and Thursdays generally clash with obstetrics. The diploma in obstetrics. Okay, let's take one more before Dr. Mpo tries again the website. Sipesa, is there a platform to receive further communication about the tutorial?
It's not allowing me.
Yeah. Is there any platform to receive? Yeah, so you can visit our website. I had posted the link where you'll find all the diploma prep. Just find the anesthetic one, and then you can just see. But otherwise, send us. Let me see. Why is it not posting? I thought I didn't see it posting. Oh, it went the other side. Yeah. So also you can just send us an email, info@clinicalcareplatform.com. gmail.com. That is the email you can use if you have particular questions that you would love us to respond to, and then we will take it from there. Yeah. Not winning. Yeah, colleagues, do visit the website, navigate it, or you have managed, Doc? Yeah.
No, it's not allowed.
Yeah, I think we can just encourage colleagues to visit the website, especially if you are planning to write. Please do go through the website and then make sure that you can track everything that is required. We will keep you updated, but I think as a person who's writing the exam, you have to go through the course regulations and the blueprints, etc., etc. Santo says the duration of training is 6 months or 3 months, full to be accepted, to be given. Or you mean from the college? Yeah, so if you have evidence that you've been in anesthesia for more than 6 months, that is good. 3 months, it's with additional. Oh, you had a slide on this, right?
Logbook.
The 3 months issue. Where you
Yes.
showed the points and
Yes,
stuff.
the 3 months is with your 500 logbook.
Yeah.
Yes.
Yeah. So if you have spent
So
less than 6 months, you need to show then the amount of work you have done in anesthesia. Yeah. Does it make sense that way? I hope so. Okay.
yeah, so let's say I did find the supervisor letter. This is the one that is on the website. So this is what you will give to your supervisor to fill in for you. They need to fill in how long you have been, whether you're competent. They still go through the competency. Are you competent in machine check or cardiopulmonary resuscitation? And yeah, they also have to say how long you have been in the. So they actually have to say you have been employed and you've been in anesthesia from this time to this time. They take it very serious how long you've been in the department. So you have to make sure you've been there for 6 months and it's in an accredited hospital by the college.
Yeah, and just to add, two important things. Number one is that, if you want to do something, you make a commitment, and there's always trade-offs. In life, we can't have everything. So it's a question of the whole thing around, if you to go up, you must give up something. I mean, it's exactly like that. I wrote my 2 diplomas in Mpumalanga where there was no accredited institution or there was no specialist in HIV medicine. So I had to travel to Joburg every single week to Hello Joseph to be mentored there. This is like 3.5 to 4 hour drive every single week, if you can think of it. So you have to make an effort, and some of you are doing calls, maybe it's anesthetic calls. Commit time to join the anesthesia department every single week for that morning meeting, give presentations, whatever you can do in that space. From us as a platform, we do give recommendation letters. We have some level of understanding with the college. The letter that Dr. Mpo is showing, you must make an effort to get your line manager to know that you are planning to write, and then so that they can give a proper motivation for you to write. From the platform, it's just a recommendation letter which confirms that we have also spent time with you, and this is the number of hours and the type of topics we have covered with you, which adds to the points to a certain extent. But please do ensure that you start to engage your line manager as early as you can. There were 2 more questions. Just give me a few seconds. Oh yeah. Does your course also include going through past papers? Yeah. So cases and like if we cover a specific topic on cardiology, it would include discussions around some of the cases and scenarios from the exam. Yeah, but we are not like so the way we do, even in the other programs, we don't teach like, because they don't tend to repeat the questions. It's very important that you have a very strong theoretical grounding, in as much as we will use the past papers for you to start to have a sense of how they ask and how best to respond based on a specific key area that we'll be learning from that week. Yeah, and then we do, from a platform perspective, we also do create mock exams. So towards the end of the program, there will be some kinds of exam type that you will need to take on your own. If you're not writing the exam and you want us to confirm that you completed the program, you must pass the mock exam that we put at the end. If you are writing, the mock exam will prepare you for the exam. So the simple answer is yes, past papers which are shared. Remember now, they don't share a lot, CMSA, since they change, especially on the single best MCQs. There isn't much, but for the short questions, there are some papers which we can then use. Dr. Nelly, your short comments on that? I think we have went beyond the allocated time. I'm hoping we can close it off soon.
Can you repeat the question for me again?
No, I was just referring. There's a question about the use of past papers as guidance, and I see Mpo has opened the page already on the website there. Yeah.
Yes, it's a very good resource to use the past question papers. It helps you, it gives you a bit of guidance as to how to approach questions, and also with your reading. Sometimes, like Dr. Hlawule said, Morgan and Michael can be a very difficult book to use, but when you can refer back to the questions and how they ask them, that might help you to sort of structure your reading and focus on the important topics.
Yeah.
So yes, it's definitely worth going through those papers.
Awesome. Yeah. Colleagues working in the district hospitals, you'll be like me. You have to have a relationship with your nearest accredited hospital. You have to make trade-offs to visit them once a week or something like that. You have to join this program because it adds to the points. Even at your district hospital there, talk to your line manager to commit how much time you are spending currently in anesthesia and some of your capacities. You have nothing to lose if you apply, but you may be admitted. You just need to show your commitment, in that space. So it's very, very important. I think we have responded to that. Molati says, how can I pay before you finish the money? Redabani 15. Pay today. Use the link I've shared and pay today before you finish the money. Otherwise, you have to wait for the 15th of October. Pagi says, okay, these are the last two questions. Pagi says, I'm sorry I joined late. I'm on call today. Our theater doesn't have network. Is there a recording? Yeah, so we'll share a recording with all of you. We'll just send an emailer with the link to everyone who has attended today. Yeah, I think these are all the questions that I could see on the chat. As we close, let me ask Dr. Mpho and Dr. Nelly for their closing remarks, and then we call it an evening. Yeah.
So yeah, I'm very excited to start this journey with all of you guys. It is going to be requiring quite a lot out of us. We are doing this for the first time. It's the first intake. You are also doing this with us for the first time. And we hope to be able to give you the information in a way that will help you eventually pass, and that you will eventually be able to, it will eventually be able to help you to increase your skills, or maybe get you a better job, or get you working independently, whatever your goal is. It's okay to want more money. I mean, we always make it seem like it's wrong, but it's okay to want more money. Maybe you want to do this so that you can eventually do some extra work in private. I feel like it's fine. That's the advantage of doing what we do. So if that's your aim, yeah, we will help. We'll try to help as much as we can, and yeah, just be committed and don't give up and keep pushing because it is gonna get hard.
Awesome.
And thank you for joining us.
Yes, thank you for joining us. Yes, I think Dr. Hlaule has said a mouthful. And yeah, I stand behind those words. All it takes is a commitment and yeah, and just keep pushing. And I know that some people, like if you're in a district hospital, it might feel like a very, very tall mountain to climb, but you have to start somewhere. And hopefully we are able to guide you and give you the support that you need. And yeah, see you on the other side.
Awesome.
Yeah.
Colleagues, we can't wait. Baki, I saw you registered today. That's why Baki is commenting. I think I saw Baki has registered today. So welcome. We can't wait to host you in October. Yeah, colleagues, that's it for tonight. Just to say thank you for joining us, and to Dr. Mpo, Dr. Nelly. Thank you for this collaboration. May God bless it so that we continue to add value and be impactful in the lives of our colleagues. Colleagues, I've shared the link. Follow the link. If you have any questions, send us an email, info@clinicalcareplatform.com. And to our instructors, may you travel safely to the Congress, to the conference, and may you come back rejuvenated, ready to empower us and to equip us and prepare us for everything that's coming ahead. Night, everyone.